So this is the section for a screw that's too long being punctured through my ankle, through my flexor hallucis longus, through my Kager's fat pad and merging it with my Achilles tendon. And this is a section for possible post-tib harvesting or overuse and damage via a screw being put in it. And the third part, the interior diagnosis I've received and the ejection administered by Dr. Paul Ohmsen, which didn't work. Now, just to give you a quick intro on why I'm making these videos, on the 18th of October 2015, I had a motor vehicle accident and broke my tibia and fibula. I was captured by the medical cult at Royal Brisbane Women's Hospital. Essentially, a guy with a mask, glasses, skull cap, everything covered so you couldn't tell who he was, walked into my ward, and then the nurse introduced him as, "This is Dr. Andrew." He didn't say a word, just waved, you know. I was on intravenous painkillers, so I thought it was sus that he was fully wearing his mask, everything covered, but I didn't think anything of it like someone's going to come in here and mutilate you, okay? Ever since then, everywhere he's inserted metalware, everywhere he's cut, everywhere he's touched, hurts like fuck. And I went back countless times and said, "I'm in pain here, 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 and here." They go, "Oh, we'll send you to an x-ray," which doesn't show veins, tendons, or anything. They sent me to 10 to 12 x-rays and they just say, "Oh, you have no metalware complications. It's completely normal." Just systemically pacifying me constantly, okay? Now, some just have their fellows back at every turn, being imbeciles and not knowing this is satanic ritual abuse or harvesting. Others definitely know. They definitely know. It's the classic imbecile versus harvester pedophile protector scenario. I just wanted fucking medical treatment. However, they won't properly diagnose the injuries, therefore I can get fucking none. So I'm left outside like a dog. They treat their fucking animals better than me. Okay? These people are bullies. They're full-on communist gatekeepers to our taxpayer-funded services. Big reason why I make this. I don't want this to happen to anyone else because it's fucking brutal as shit. It's the worst fucking crimes you could ever imagine. Well, not ever imagine, but they're bad crimes. Now, the public needs to wake the fuck up and realize they're taking health advice from motherfuckers that forcibly harvest tendons and veins for elitist gains. This is complete systemic corruption. Just listen to Dr. Vernon Coleman and others. Don't listen to me. Now, this is exactly what happens. Something that really resonated with me with Bill Heffernan's speech. He's like, it's not the act of the 28 people that are suppressed by the government suppression order. It's what happens when these people in high positions of power get together. And this is what happens. They will someone in their group will be like, "Oh, I'm having a cardiac problem. I'm like 70. Oh shit, if you take my safenate it's not going to work. Oh shit, look at that 22-year-old. Yeah, take his. Oh, I need some tendons too. Take his." And then everyone just covers it up, okay? And now they've fucked me up so bad that I have to go back and dial in the information and do each segment by segment to accurately document, okay? Now, let's get started. First, start with the flexor hallucis longus. I'll start by showing you a normal ankle. That's a normal ankle, okay? And this is my ankle. See that front screw on an upwards trajectory? Now, I don't know what this is. I'm just fucking ignoring that for this video, and I won't make a video on this part because I have no clue. However, I did take these images, printed them off, and took them to a doctor, Dr. Lawrence Zalakor. And then I asked him, "Is this my flexor hallucis longus being punctured through my Kager's fat pad?" See how the left one, it's intact, and the right one is not intact. And it's in various segments, okay? So I've specifically asked him, and then I'm like, "Is this a punctured fat pad?" And he said, "Yes." We'll just get onto some anatomy. So what I'm saying is the screw's been punctured through my tibialis anterior. It was meant to stop at this part of the tibia, but it's busted through, hit my flexor hallucis longus, punctured through my Chagas fat pad, and merged it with my Achilles tendon. These are the images again of one MRI. Now I've had multiple MRIs. So as you can see, this is still intact the whole time, but whereas the place is operated on is busted. Okay? Now I'll take you over to the other MRI. I'll show you the outside of the ankle on this MRI first. Alright. See that little white bit there? Possibly that's where it's punctured through. I'm not sure, but this shit does not look good. It does not feel good anyway. It looks how it feels. I can't stress that to you enough. Something these doctors just don't... They're bullies, they talk... Yeah. They're like, oh, what medical degree do you have? Well... And then when you try to show other doctors, they're like, whoa, I'm just flus and colds, man. Don't show me this. Literally. That I quote. Now, we come over to... This is a different MRI taken on another day. And you still see the puncture there. Now, when does it start? We're going up the ankle, up the ankle, up the ankle. It started, and then puncture there, and you can see the screw tip poking through there. I mean, it just looks how it feels, okay? Then we'll jump over to the outside view. And as you can see, look, that's got to be some sort of damage there from that middle screw going through. Okay. Now we'll go through my post-tibial tendon. That is my post-tibial tendon. Connects there, comes up behind your medial malleolus and really hugs it and hugs the side of your ankle. Now, how he's cut me open, he has, instead of cutting a straight cut, he's put the screws along my tendon. I wonder if we can... Right, this is what I mean. Okay, you see this scar here? That was the little scar where it was used when I came back and said, fuck, these screws hurt, I want them out, okay? He lines it up perfectly with this one, okay? So he cuts them in a straight line. But when the dude's doing the surgery, he went through this one, and then instead of just going straight down, he made another cut along my post-tibial tendon. And this is right on my post-tibial tendon, okay? See how the post-tibial tendon angles down like that? Angles down like that? What he's done is he's cut there and then he's cut along it as well. Whether this is, well, I believe it could be harvested, because when you compare the two, okay, see how this post-tibial tendon's nice and elongated? It's not round. Then you come through here and it gets a bit rounder as it gets up there. Where's another one? Yep, that post-tibial tendon there hugs it nicely. And then we'll take a look at mine in comparison to the left one. Okay, this is MRI, this is left, this is right. There's just a lot more mass in my left hand post-tibial tendon. And that's a fair bit thinner for some reason. And even here, it just feels like there's more mass in that tendon. So it comes out to there, whereas that kind of stops. We will look at it on multiple MRIs. Oh, fair bit more mass, less mass. Now, they can just remove a damaged portion of the tendon, so it's, see how he's cutting just the side off there? So he can cut a little bit off. Whether he's done that, I don't know. We'll just keep looking at the MRIs. Do you see anything hugging the backside of my medial malleolus? No, you don't. You see anything hugging the backside of that medial malleolus? I believe that's my post-tib there. It's kind of mangled about there. It hurts. Whether they've just hit it with a screw, because the other MRI 100% looks like that. Now jump over to this MRI. See that screw hole there? Yeah, fuck oath. Of course you can see it. Yep. You'd be blind Freddy not to see that. Alright. See, it's hitting that post-tib there. And notice how there's not a lot of medial malleolus. Oh no, there's not a lot of post-tibial tendon like we saw in... Where is it? In this one. See how that post-tibial tendon really hugs that medial malleolus? It just doesn't do that in the MRI of my ankle. Is that where it's meant to be hugging? But it's torn? Who knows? All I know is instead of cutting straight below and putting the screw straight below, he's deviated and gone off at an angle like that right along my post-tibial tendon. 10,000% he has done that. I've got the fucking scars to prove it. Whether he's harvested it or just hit it with fucking screws like it shows right there, right there, right there. Whether he's just hit it with screws or he's chipped a bit off there and then peeled it down here and then used it for somebody else's tendinosis and he's transplanted it to someone else. I don't know. It hurts? Yes, it fucking hurts. It hurts like this, okay? So, but they won't diagnose me. They won't acknowledge. Well, there's definitely a branch of the vein cut there as well, okay? Now, see how you can't see any post-tib hugging it? Other than, I don't know what the fuck this is. Is that the side of my post-tib that's been peeled off? And then there's little strands and fibers? I don't know. Even there, it should hug it way more. But it just does not. Another MRI. This is a side-on. Is that damage? Well, it feels like fucking damage. They won't acknowledge it. See how that's a little less shaded than it is on that post-tib. That post-tib's nice and uniform. Whereas you go down here, limited post-tib, you've got quite a bit of post-tib. I'll be honest with you now as well. That also looks like where a screw's been punctured through. we'll just look at the front of the ankle real quick. What's that? I don't even fucking know what this shit is. Who the fuck knows? Not even looking at that. Just see that tip of that post tib there? It's not really doing what it should, or what the other examples look like. See, that's a nice fat post tib, and then when it gets to there, it loses a bit. Whether he's just hit it with the screw, as in right there, and then it's shredded, or he's intentionally, instead of putting a fucking screw in there and then a screw in there in a straight line, he's gone down on that angle following that post tib and then harvested a bit of it, maybe like what, 5-6 centimeters or something, cut off the side. So he's got a nice little chunk there to use for someone else's surgery. I don't know. But I do know my leg broke in the middle here, and then he's gone in here and he's gone in here. He had no fucking reason to touch here or here. He could have put a plate on, he could have external fixation, he could have cut me open once and put a plate on. Instead he cut me open 7 times to put screws everywhere he fucking needed to. Just in excess. Now, he also didn't use the correct size rod. Measured to 42 centimeters, however the longest was available was 40 centimeters. And this is after he's cut the fucking side off my patellar tendon. So he couldn't take a preoperative measurement. 15 years of fucking training and you can't take a preoperative measurement. Who the fuck is this retard? Now, yeah, so I don't know. What's he done? Doesn't look healthy, that's for sure. We'll over and explore this bit, tiny bit more. When this screw comes in, it certainly comes out this side here. The front screw comes out this side here. Punctures that. What the fuck? That's like double and a half the length it needs to be. He's just ripped it in. I think he would have had to just rip it in and rip it out. He's like, shit, we've harvested a bit off this dude. The only way to cover up our crimes is for him to kill himself. So he's done everything he can to inflict as much damage as possible. Now, notice one thing here. Do you see any fucking breaks? Do you see a broken ankle? No. Nothing is broken here. Okay? He's just operating on it. God knows why he's operating on it. But I was literally a massive black cock away from this area where it broke. It could have been sorted with a cast. It could have been sorted with numerous other things. But instead, he's decided to mutilate me to the best of his fucking ability. What's that fucking big chunk out there? Who the fuck knows, alright? And then it's definitely got a puncture wound through there. Okay? Now we'll jump over to the interior diagnosis. Now, I've been told this is synovitis. I've been told that why I'm in pain in the front of my ankle is because I have synovitis and I required an ultra-guided sound injection of xylocaine and Celestin. Now, this shit fucked me up. I felt like it busted whatever he injected, and I haven't really been the same since, okay? If this is synovitis, I apologize, I'm wrong. But does that look like synovitis? That's exactly where he injected Dr. Paul Ohmsen. And then this is what he's looking at under his MRI. And he's telling me, oh, all this is normal. Well, he didn't acknowledge it. Systemic corruption, okay? Now, I asked him about my post-tibial tendon. I'm like, what's the condition? And he's like, oh, you don't have post-tib. as in saying I don't have post-tibial tendonitis. But he said it like, oh, you don't have post-tib, like with a little chuckle on his face. So as if to possibly say, oh, we've harvested your post-tib and you don't have it. Now, that's just what he fucking said, that I don't have post-tib. What he meant to say was I don't have post-tibial tendonitis. And 6 months later, asked multiple people for MRIs, and then I've sent myself for all these own MRIs, pushing to get my own MRIs, and this is what my fucking ankle looks like. So yeah, I guess that concludes the flexor hallucis longus being punctured through, as confirmed by Dr. Lawrence Zalakor, and then he sent me off to get surgery, and then nothing happens. They just go off the fucking surgery reports, which says nothing's wrong. And then when you try to talk to someone about it, they're like, whoa, we don't want to contradict the orthopedic surgeons. So they've just got a bunch of gang stalkers, government-funded fucking gang stalkers. I've tried to go to the police. The police goes, oh, take it up with the hospital. I'm like, look, mate, give me 15 minutes of your time. Just let me do a statement. Look at these photos and tell me if I have cut veins and I'm not getting enough blood through to my head. I've been everywhere over the past 6.5 years. I've been to a pastor even, okay? You want to know if a pastor's involved in satanic ritual abuse? Go ask him about it. This pastor I talked to at Riverside Church, I'm just basically asking him about satanic ritual abuse. I'm telling him, showing him these, showing him what happened to me. And his hand starts shaking like this. Not just the normal jitters. His hand starts shaking inch to fucking inch. Just like whether he's been through something or he's involved in something. I don't know. But if I come and start talking to you about things and your hand starts shaking uncontrollably, I'm going to think you're fucking sus, okay? Now, is there anything else we can look out on here? Oh yeah. I'd like to know, this little bit coming off here, is that where the screw punctured and tore a bit off my flexor hallucis longus, or what's this? Is that doesn't look like my plantaris tendon. Or if that is a plantaris tendon, it's a fucking damaged one, okay? So fucks me what these cunts are on, really. So I just got to document it, because talking to these people is like talking to a brick wall. They can't give you a logical explanation. You say, is that my flexor hallucis longus being punctured through my Achilles fat pad into my Achilles tendon? And you catch them off guard, they'll say yes and give you a referral to fucking surgery, and then it just dies. And then you're like, what happened to this? They're like, oh, go off this. And then, yeah, they just give you explanations like this woman does here, okay?
My understanding is it's not as good as what we were at this time last year, so we really want to push that message to people that it is the time to get your flu vaccine.
Now, I don't know, I've pretty much covered it all. Peace out, guys. Give you another quick look at all the punctures. Alright, see this screw here, track marks, boom, boom, boom. Should stop there, but it doesn't. Just mutilates that fat pad there. It's not normal. And they keep telling me, well, they don't look at this. They don't look at these. They go off a fucking report done by Gooks, which I made a video on as well. And you know how much Gooks love to fucking harvest. Forced tendon harvesting is the most prominent in China. Go bang, bottom screw, punctures, doesn't stop. Then we go middle screw, interior, doesn't fucking stop. Punctures through a length and a half times it's meant to. Punctures through there, punctures through a length and a half. And then we'll come up again, other screw, doesn't fucking stop. Look, whether this was fucking designed to inflict pain or some sort of maneuver to help him harvest more from my body, I don't know, okay? Because reason being I don't know is because the other pictures just make it darn obvious. Like, so obvious. Well, I'll just upload it right now. Oh, and here's more proof that I've had my saphenous vein harvested. Statue of saphenous vein. Bam, 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 bam. Gone. Fucking gone. More proof that I've had my saphenous vein harvested. I've done a full 20-minute video on that. But nobody will reply. Nobody will get back to me. No, they just lie and lie and lie and lie. This is... Now I understand what people say when it's all a fucking facade and all an act. Can't understand it.
Guys, how many of you have looked at somebody who's taken the jab and been like, they're just not the same? There's something off about them. And people have speculated that it can cause neurological disorder. Well, guess what? New studies prove that the COVID vaccine is directly responsible for causing what they're calling functional neurological disorder. And it's from the University of Toronto, right in our own friggin' backyard. Yeah, that's right, Toronto.
Shit, we just left there.
So guess what, guys? When you're seeing your friends and family walk around like friggin' zombified sheeple, it's not in your head. It's a symptom of the jab. They want them to be even dumber so they can convince them to get another one.
Anti-socialism.
My friends, I pray, sir, you gotta repent, sir. You gotta repent, sir, for murdering babies.
Why?
Because it's a sin before God.
Why?
Wow.
Stinky breath.
Yeah,
Why?
that's pretty evil of you, sir.
Yeah, I am.
And I hope and pray that you...
Yeah.
Well, that's what you do to babies, huh?
Yeah, I love it.
You love it, huh?
Yeah, I do.
Okay, I hope that you come to Christ, sir.
Oh, I never go to Christ.
I hope that you come to Christ,
No,
sir.
I don't go to Christ.
Yeah,
I don't listen to Christ.
You will have a darkened heart, sir.
I do have a darkened heart. Yeah.
You have a darkened heart.
I do, very, very much so.
And you will stand before God in judgment day.
Yes, I will. Every day.
You will stand before God in judgment day.
Yes, I will. Every day.
All of the babies that you have killed.
I love it.
Yeah, keep tearing the babies apart.
Yeah, I will.
Keep tearing the babies
I
apart.
will.
Keep tearing the babies apart. Yeah, sir. The babies, their blood screams from the ground. Their blood screams from the ground. You are a murderer, sir. You are a murderer. Hello, officers.
National health care. Now, most people say, we've suffered so long. Canadians have got national health care. The British have got National Health Service. We've got to have national health care. And Hillary Rotten Clinton tried to bring national health care in with the electronic medical record, the EMR. The EMR is an electronic choker chain on your doctor that if they don't do what their Nazi Dr. Mengele commanders tell them, they'll yank their license. They'll yank their chain, they'll prosecute them, and they'll imprison them. So a large and very powerful leg of the New World disorder is your doctor. Because most of the really bad things they want to do to you, including implantation of chips, vaccines that are psychotronic that will rewire your brain, vaccines that will insert DNA to alter your genetics, vaccines that will cause cancer, vaccines that will program so that you will actually be sensitized, I call brain tenderized, to ELF technology that can transfer thoughts and insert them into your mind and your body and control your very physiology using scalar technologies. All of these have been developed and your doctor will administer them. Just like the big pharma drugs that are administered that are slowly killing our elderly population and turning them into demented fools. Okay? If you think that politics is corrupt, medicine is 1,000 times more corrupt. 1,000, because the victims are either dead, dying, or wish they were.